Hey, deserving listeners, Amber Heard, Johnny Depp trial, let's watch. I'm so excited because we're going to get to hear Dr. Curry's response to Dr. Hughes, who was responding to Dr. Curry. I'm really curious as to what they're going to say here. Let's watch. My name is Dr. Kirk Honda. I'm a therapist and a professor, by the way.
Speaking, there are three main categories that I'd like to talk about today. So the first is that Dr. Hughes misrepresented the tests and the results that she utilized in her evaluation.
Interesting. So we're going to hear from Dr. Curry, who is commenting on Dr. Hughes, and she is going to critique Dr. Hughes's usage of the tests and the interpretation of them. That'll be interesting to hear.
Misrepresented my testing and the results that I obtained in my.
Also, she's going to respond to Dr. Hughes's criticism of Dr. Curry's interpretation of the MMPI, I'm pretty sure, and possibly the CAPS-5.
My evaluation. And she communicated in a manner, provided testimony in a manner that presented essentially her own opinions and the self-report of Ms. Heard as facts.
Right. Good. So she is going to point out, I guess, I'm just predicting that she's going to point out that Dr. Hughes presented Amber Heard's account as factual when, of course, forensic psychologists don't usually do that, at least in my circle.
Okay, the first category you talked about was the misrepresentation of her own test methods and results. What do you mean by that?
So Dr. Hughes she stated that she administered 12 tests. In actuality, she used 8 checklists.
Yeah, I was saying this at the time as well, that a checklist, I guess you could argue, is a sort of a test, but they are very easily feigned and lied on because you're just giving someone a checklist, essentially, and it has a technical name, and Dr. Hughes provided that. And if someone wanted to lie, they'd just be like, yep, I got that, I don't have that. And it's pretty straightforward. Those were the instruments that Dr. Hughes used. 2 of the PTSD instruments that she used was a self-report of the clinician, which is based on the self-report of the client, of course, and a self-report for the client. And why would you do that? I mean, I guess you might do it as a preliminary exploration. And Dr. Hughes didn't really deceive in this way, but one could be confused if you're on the jury. It's like, well, there were 3 tests about PTSD, and they all showed that she definitely had it.
Half of those were symptom checklists. The other half were checklists about experiences that people can have with domestic violence, and those are not.
Yes, absolutely. I was saying the same thing, I believe, back then, at least I was thinking it, that with the intimate partner violence checklists or instruments, they're not tests in the way like the MMPI. MMPI, PAI, these personality tests are really hard to lie on. In fact, they have all these validity scales and tons of research, and the questions are designed in a way to not really let you in on what they're trying to get at. Some of the questions don't even make sense as to why they're correlated with. There's certain items on the MMPI in particular that are associated with certain disorders. And when you look at the question, it's really hard to determine why that would be associated, but research shows it. So you're like, okay, I mean, when you put all the data together. So with the intimate partner violence instruments, measures, checklists, surveys that Dr. Hughes administered, they're interesting, but they're completely reliant on the assumption that the person taking the test or the survey is telling the truth. Dr. Hughes wasn't deceptive in this way, but it's important that Dr. Curry points out this very important point. And so the finding of Dr. Hughes and Dr. Spiegel that Amber Heard was a victim of domestic violence completely hinges on everyone's assumption that Amber Heard was and always has been telling the truth to multiple people, on these tests, but also to previous individual therapists. And again, I want to remind everyone that the couple therapist said Amber was not the victim. If anything, she was the perpetrator. So that was one clinician who actually saw them in a room together, provided an opinion to the court that apparently everyone disregarded. Now, I don't know, like I've been saying from the beginning, if I read all of the progress notes from all those previous therapists, maybe I'd be like, oh, that doesn't sound like a lie to me. And I've also been saying from the beginning that I think some of Amber Heard's accounts of abuse, physical, are likely to be true. I don't know, obviously, but I have a hard time believing that with what we've heard, audio recordings, even what Johnny Depp has reported in terms of what he's done, the text that he's extent that I'd find it hard to believe that he's never been abusive. So, but anyway, so great. This is going to be very satisfying to me, I'm guessing.
Appropriate for forensic settings, they are easily exploited.
Other issues that you intend to address relative?
Right, so she says forensic setting, which is important to point out that if I were to assess a client, there's not usually a situation where the client is trying to lie to me. There's not a question that is going to be litigated in court or something. It's just me trying to figure out what's going on with someone so I can help them, and they're very interested in me understanding them in an accurate way. So the instruments that Dr. Hughes mentioned are absolutely appropriate for that venue, not for forensic psychology where you're trying to determine if someone is lying or not, or who was the abuse perpetrator or victim. If Dr. Hughes had given those instruments to Johnny Depp, I'm guessing that there would be opposite results showing that Johnny Depp was in fact the victim, just because someone checks a bunch of things like, yes, I was hit. Yes, I was sexually abused. Yes, I was yelled at. Yes, I did feel unsafe. It's fine again in the clinical setting, but not in the forensic setting.
Misrepresentation of own results?
Yes, so in addition to using these checklist measures, which are easily exploited in a forensic context, they're developed for research or treatment only. She also stated that these checklists revealed things that they simply cannot reveal, especially in this context.
Yeah, I don't know if she's referring to this, but having a positive result, so to speak, on an IPV checklist test does not indicate that it actually happened. For example, if you were doing a forensic investigation and you had a psychological component of that, and someone was being accused of being a perpetrator, and there was a lot of evidence showing that that person was a perpetrator, and you gave them one of these instruments, and the test results revealed that this individual is in fact the victim, you would never regard that finding as a valid instrument to derive an opinion about. All you know is that the person is reporting that they are a victim. You know nothing about what actually happened.
She also misrepresented information, clear indications on several of the objective measures that she offered. And there were indications visible that Ms. Heard had essentially engaged in what we call response distortion. So clear indications of exaggeration on.
Okay, so this will be good. I'm looking forward to this. And I hope that we get some actual examples, because the first time that Dr. Curry testified, we didn't get specifics around exactly what are we talking about. They were talking about an ATR result and a K-scale result, but there were no numbers provided. And I mean, of course, why would you provide that? Because the jury doesn't know anything along those lines. But I don't know. I hope I get it. The T-scores, for example, on the 3-6.
One of the measures that's specific to PTSD, clear minimization of symptoms, intentional, on another more broad personality and psychopathology-based measure that she gave to Ms. Heard, which she did not acknowledge.
Did you intend to address anything relative to the CAPS-5?
I did. So Dr. Hughes administered the CAPS-5 about 10 days after I did, almost 2 years after she initially tested Ms. Heard.
I didn't know that Dr. Hughes administered another CAPS-5. That's interesting. I don't remember Dr. Hughes talking about that. I remember her refuting what Dr. Curry had interpreted from Dr. Curry's administration of the CAPS-5, but I don't remember Dr. Hughes administering it. Maybe I missed that part.
And she did not administer the test appropriately. So she left major components blank. She didn't apply the scoring rules that are clearly outlined with the test.
Okay, so Dr. Curry is saying that there are sections that are blank on the CAPS-5 and that she didn't interpret the results correctly. All right, what does that mean? Well, Dr. Hughes might say, well, I wasn't really using the CAPS-5 in that way, but that would be strange in a forensic investigation. She could say that I didn't write, yeah, that's interesting. Why would there be blank spaces? If it were a clinician, if it were me, and you looked through one of my files on someone and you saw blank spots, you wouldn't know. And if you asked me, I'd be like, well, I got enough information from the first few questions, or we ran out of time, or The client said they didn't want to do it anymore because they were being triggered, because that's another thing that can happen when you're actually testing for PTSD. In fact, there are some measures of PTSD that I actually won't administer in the beginning because I have experienced people being triggered just by the questions alone. Their PTSD will be triggered because the acknowledgement of the symptoms for some people reminds them of why they have those symptoms, and then that reminds them of the trauma, which of course causes a spike in distress. But in a forensic investigation, to have blank spots, that's odd to me. Of course, if there were blank spots, you could never draw any conclusion because it's a botched test. The research around these instruments require that you follow the protocol to the T, and if you do not, especially in a forensic investigation, someone can say, well, you didn't administer it right, so the whole thing has to be thrown out, and they would be right. But then she's also saying she didn't interpret it right. So we heard both of them say different things. Dr. Curry said there's clear evidence that Amber Heard, while trying to provide details of her PTSD symptoms on the CAPS-5, failed to present symptoms in a descriptive way such that the evaluator could confidently say that the person actually does have PTSD. In fact, it looks like the person...
and yet she diagnosed Miss Heard with PTSD based on that assessment.
What about Dr. Hughes's use of the personality assessment inventory?
So of the tests that Dr. Hughes administered, 2 would be considered, of those 12, 2 would be considered what we call forensically relevant instruments.
Yeah, so what she's saying is that of the 12, there were only 2 that are not easily feigned. They're not easily faked, and PAI is one of them. So yeah, absolutely, because a lot of the other ones were just self-report. Essentially, you're just asking someone, tell me what happened to you, or tell me if you have PTSD. And of course, in a forensic evaluation, it's interesting, but of course, it's limited in terms of its value in a forensic investigation.
Meaning that they're objective enough, and they provide us with some information about how the examinee approached the test, that it would be appropriate for this setting where the examinee is going to have a natural incentive to present themselves in a way that benefits the outcome of their case. Now, on the PAI, there were clear indications that Ms. Heard was responding and obtained scores in a manner that's consistent with individuals who have a personality disorder. And there was also an indication.
Well, that's interesting. I'm guessing we're not going to get the details on that, but she's saying that her responses to the PAI, similar to the MMPI, demonstrated that she might actually have a personality disorder. And Dr. Hughes subdued or minimized that and didn't mention it when she was on the stand. Do they call it on the stand? Lawyers out there, tell me, Attorney Craig, is it on the stand? Or is that just sort of layperson slang? I keep using it. Every time I say it, I'm like, is that the appropriate term? I'm sure there's all sorts of legal terms that I'm botching, but so that's interesting, and I hope we get the exact scales that she's talking about, the exact findings. I'm guessing that we're not.
That several scales, we call this a configuration. So you might have one main scale that you notice is elevated, then you look for additional subscale information to get additional information on what could be elevating that scale. And there was a configuration that showed that even though Ms. Heard had moderately elevated one of the scales that can be associated with trauma, that elevation is better explained by childhood or distant traumatic experiences.
Interesting. Now, again, it's not a slam dunk indication that Amber Heard is lying or confused or anything, but it does say something that on the PEI, she had an elevated scale indicating that she had experienced trauma, and there are subscales to those scales to inform how the elements of that scale break down. Like, you can be elevated in narcissism, for example, but there are different elements within narcissism, and these subscales can help to provide more context to that personality trait. And so with trauma, there's a subscale regarding where it comes from. Does it come from childhood trauma, that sort of thing? And apparently that was elevated. So that would, of course, bolster Dr. Curry's contention that if she had any sort of trauma, it was mainly during her childhood. There was an indication of trauma effects during her relationship with Johnny Depp. Dr. Curry has never said that Johnny Depp was not violent. She has steered away from that question because, of course, ethics dictates that you don't comment on things that you don't know anything about.
a person who's being evaluated is going to have major incentive to present in a way that benefits the outcome of their case. So you always approach the examination, I believe Dr. Hughes said, with a healthy dose of skepticism, but that alone is not enough. We have to operationalize that. So we actually have to administer very comprehensive objective tests that either control for attempts to manipulate the test results or reveal attempts to manipulate the test results. So
yeah, absolutely. She's explaining it very well, much better than I could. Another thought that pops in my head is, if Amber Heard loses, what decisions were made that might have hindered her? And there's a possibility that the countersuit actually hindered her because she had to claim damage to herself, to her career, and to her mental health. I'm pretty sure that's part of it. And that's why she actually had to submit herself to forensic psychology evaluations by Dr. Curry at the very least, and of course Dr. Hughes, who would be apparently on her side. Because the question of PTSD is, I don't think it's a major focus for everyone, but it does complicate things, and it does lend itself to someone like Dr. Curry saying she's lying. So it just adds another question mark to the jury that wouldn't have been there otherwise, right? And I think, and I actually haven't seen this testimony yet, and I might not react to it because it's not really down my alley, but there are experts who are coming into the court talking about whether or not Johnny Depp or Amber Heard have been harmed by them criticizing each other or claiming things about each other in the public. And I think that the overall vibe is that the witnesses demonstrated that Johnny Depp has been negatively affected, particularly by not getting one of the Pirates of the Caribbean movies. And so therefore his claim is at least justified in that way. But Amber Heard's isn't necessarily. And again, because she countersues, not only does she have to submit and somehow prove that she has PTSD, but also she has to prove to the court or answer a lot of questions regarding her career being negatively affected because of things that he did, not out of defending himself, but actually just preemptively, without any reason, just attacked her and lied, and that has destroyed her career. So I think, 40%, maybe more, of the questionable statements that have been made by Amber Heard and others around her that the jury might be mulling over might be around that decision to countersue. You just have to wonder, if she didn't countersue, she would never have to be evaluated. So that whole question as to whether or not she has borderline or not would not be a question. The whole question of whether or not she has PTSD or not would not be a question. So I just wonder if it's hurting her because of that.
That we're not just blindly accepting the results or the self-report of the examinee.
How many tests were administered by Dr. Hughes?
She said that she administered 12 tests.
How many of them were appropriate for forensic physical examination?
Well, I think she's going to say the PAI and the CAPS-5, even though the CAPS-5 was only halfway done. Or was there another one that she administered? I can't remember all the ones that she administered.
So the trauma symptom inventory is appropriate. It's an objective measure, and it does have 2 primary scales.
Right, I forgot about that. So she had 3 PTSD measures, 2 checklists that aren't very helpful forensically, and the TSI-2, which has a validity component to it, meaning that it tries to figure out if someone is lying or not. But I will say the TSI-2, the validity scales aren't as reliable as the PAI or the MMPI-2.
That look at how the person approached the test. The personality assessment inventory is an excellent test. It is a broadband measure, meaning that it captures not only symptoms of mental illness, but also general personality traits. That also gives us pretty detailed scales similar to that one test I administered, the MMPI, that tell us a lot of nuanced information about.
Yeah, the PAI is, as I talked about this back when it was being discussed, is in my circle less used than the MMPI-2, but I remember liking it because it was developed more recently and the language in it is much more contemporary and understandable. I mean, there are words in the MMPI-2 that we no longer use in psychology. There are words where I'm like, what is that? Because it was developed, I think, in the 40s or something. I sometimes still, because I don't look at MMPI results very often, so sometimes I still have to, what does that word mean again? I have to look it up. Like, there's a masculinity-femininity scale that is one of the 10 main scales on the MMPI-2 that was developed originally to detect whether or not someone was gay or not. It was primarily geared towards men, trying to identify men who were gay. I mean, just think about that. And you would have a test, and one of the, alongside hypomania, schizophrenia, paranoia, anxiety, depression, psychopathy, one of your top 10 most interesting questions that you want answered about your patients, because this is mainly normed and developed for inpatient individuals, whether or not that man is gay or not. Like, what does that have to do with anything? Then, of course, it was pathologized in the past, not by everyone. There's been a debate from the very beginning. Of course, there's no debate now. There's zero debate now, to the effect that it's even illegal in most jurisdictions, if not all, to have a therapist engage in conversion therapy or trying to convince someone who is gay to not be gay. Masculinity, femininity, over time, they retained it, I think. Personally, this is just me speculating, because it's like the Constitution, right? The American Constitution, United States Constitution. It's really hard to let go of the founding fathers' vision for the country because we have sort of a religion around that beginning. Instead of saying, well, it's 250 years later, I think we can look at it through a different lens at this point, anyway. And we've done that over time, amendments, blah, blah, blah. But I feel like the MMPI 1 was looked at in that way. It was like this handed to us by God, and you can't mess with it because it's so special. Or when they revised it, the MMPI 2, there was still a lot of sexism, misogyny, and homophobia and heterosexism infused, not only in our culture, of course, but also in those individuals who were developing the instrument itself. Today, the masculinity femininity scale is used to measure if someone is masculine or feminine. So just imagine that for a second. Now, of course, someone that understands gender and socialization and sexism would be able to look at that scale and interpret it with that understanding. But anyway, the norms are given to us such that the scale, when you're elevated as a man, if you have an elevated masculinity femininity scale, you exhibit non-masculine traits like child rearing and cleaning around the house, that kind of thing. So just soak that in for a second. One of the top 10 psychopathology scales on the MMPI. The other ones are fine, or even more than fine. They're very, very useful. The masculinity, now, of course, contemporary interpreters of the MMPI-2 will do so very responsibly. So, but I'm just saying all this because the PAI doesn't have any of that stuff.
The questions are just too odd for somebody who has the wherewithal to be trying to have PTSD to endorse. They see through it. So she used that. That's a fine test, but not appropriate for this context.
Of the various tests that she administered, how many were these checklists?
8 of them.
All right. And what are you talking about specifically?
Okay. So I had mentioned that there were
Right, there were the 2 PTSD checklists. The TSI-2 is kind of like a checklist, but it's not as easy to fake as the 2 other ones. I think she had 3 intimate partner violence measures that were also self-report checklists, right? So we're hearing 8. What were the others?
There are 2 main categories of checklists she used. The first is the symptom checklists. Those included the Beck Depression Inventory. It's a brief inventory.
All right, I forgot. So Beck Depression and also the Anxiety Inventory, which are just quick checklists on and the severity of one's depression or anxiety, which would be very easy to fake, extremely easy. Now, in the clinical world, those 2 instruments are extremely useful. I've used those hundreds of times. It can be filled out pretty quickly, like in 5 minutes, maybe even less, and you can use it to track over time how anxious someone is or how much depression they feel, because you're always wanting to test to see whether or not your treatment is working or not, right?
I gave the Beck Anxiety Inventory, very similar, but just with questions about anxiety. She gave the Mood Disorder Questionnaire, which is a very brief, again, checklist. It shows symptoms of bipolar disorder. Bipolar disorder is a mood disorder where you might have an extended manic episode.
Interesting. I don't remember the mood disorder measure, but okay. So she tested for anxiety, depression, mood disorder. All right. I don't know why, because that wasn't really, but if you're doing an initial evaluation, it would be, interesting.
And then a very extended depressive episode. And then she gave the post-traumatic stress disorder checklist, and that is a screening instrument only. It contains every single symptom of PTSD.
What I think she means by screening is that you are very quickly, sometimes without having even met that person, they just walked into the office and you just give them this piece of paper and they fill it out. It's very similar to the kinds of forms that you'll get when you go to a dentist or a medical office, and there's those things like, do you have hypertension? Do you have back pain? It's just like that, except it's specifically trying to get at specific criteria to PTSD.
So there's a secondary danger here too. When you think about it, given that PTSD is the most frequently feigned and claimed diagnosis in civil courts, if you're handing somebody a checklist that lists every single symptom of PTSD, you're essentially teaching them all the little nuances that we're looking for.
Yeah, absolutely. But if you're a forensic psychologist working for the Amber Heard team and you don't want any record of feigning, then you will avoid all the instruments that involve that. Now, the TSI-2 does have some validity measure to it, but you, of course, wouldn't necessarily want to find that Amber Heard is lying because maybe you feel like you're not going to get hired by this crew, or you'll never be hired again by these sorts of people, or you absolutely believe, like I said, she absolutely has been abused and I don't want to stand in her way, so I'm not gonna, administer this other test because it might get a false positive, and I don't want to harm her because she's an actual victim, and da-da-da. So, who knows what the motivation was. But the other thing, getting back to what I said, imagine a physician diagnosing you from that piece of paper that you fill out when you fill out that piece of paper that they give you on that clipboard. Imagine a physician just looking at that and saying, oh, okay, cancer, that person has, you wouldn't do that, right? That's what she means by screening.
Give that diagnosis. So she gave that to Ms. Heard. Ms. Heard endorsed most of the items, and Dr. Hughes diagnosed her with PTSD and substantiated that opinion by Ms. Heard's checking those items on the PCL-5.
Now, what Dr. Hughes would also say, in addition to that, is she didn't just use those checklists. She also gathered information from all the individuals Amber Heard, her previous therapists, collateral contacts, probably the audio recordings, I'm guessing, I don't know. So she wouldn't say she solely diagnosed Amber Heard on those checklists alone. But she did present it in a way as if it strongly supported her finding when, in my opinion, it doesn't say anything about her finding. The one piece of Dr. Hughes' testimony that I am convinced by is the gathering of all that other information that she talked about, which I don't have access to. Because, Amber Heard, years ago, prior to the divorce, so early 2010s or something, was going to therapy, I think, because there's a number of therapists who were working with her while she was with Johnny Depp. And these individuals have in their notes that Amber Heard is talking about being traumatized and having trauma symptoms. Now, could she be lying way back then? Yeah, but why would she be lying to her individual therapist well before there was ever talk of divorce? So that's not likely to happen. Now, does that mean that she had actual PTSD, or was it just exacerbating or triggering her PTSD from that she developed when she was a kid, which there seems to be some indication in her progress notes of that, according to, I think Dr. Curry pointed that out. Or is it borderline personality disorder? Because the triggering that a borderline individual can go through is identical often with the triggering that we see in people with PTSD. In fact, a lot of people consider borderline to be a form of PTSD. So, for borderline individuals, when they're young, they often experience one or two major traumas. One is abandonment, and the abandonment can be very obvious or it can be subtle. Like when you abuse a child, it can feel abandoning because the good parent has abandoned me and the bad parent is here. Because children often think in that black and white thinking, as borderline individuals do as well, because they don't graduate to the next developmental phase of understanding that the good and bad actually exist in the same person. So there's abandonment, but there's also harm that borderline individuals will experience. This idea that close people are going to harm you, they're going to abuse you, they're going to hurt you, they're going to purposely harm you. And borderline individuals almost always have the abandonment / betrayal aspect. They don't always have a strong harm schema, but they can. So imagine if you had these experiences of abandonment, either emotionally or physically, and then harm, and then you have this reactivity for the rest of your life until you go through therapy and have insight and all that kind of stuff. And when you're an adult and you're in a relationship and your partner is yelling at you and getting angry at you and then running away and locking themselves in the bathroom, you could imagine that that would be exactly triggering to the very real traumas that you went through when you were growing up. Because to a 3-year-old, to be abandoned, it feels like a death sentence to the child. We evolved to feel tremendous fear when our parents leave us. That might not even necessarily be rational, like in a divorce, and one of the parents leaves the state and the child doesn't see that parent anymore, even though they had bonded to some extent with that parent. There's not a lot of danger to that because the other parent can certainly take care, and they're, say the grandparents are around and that sort of thing. So there's not an increase, especially not an increase in danger in the way that it can feel to that child. It can feel, because we evolved to be attached to our caregivers, the people we've attached to, and we evolved to feel tremendous fear when we aren't able to access them. And that needs to be understood when we're helping young children. As they get older, they can sometimes handle it, more and more as a child ages, 7, 10, 13. But when they're very young, they often cannot handle it. Depends on the situation, depends on how much bonding they had with that individual. Sometimes it can't be helped, So you can imagine that trauma, it's fear-based. It's not just like, oh, I don't like that. It's terror. A feeling of terror, of abandonment, a feeling of terror when someone is angry, because it usually precedes beating and abuse and throwing them out of the house, really horrific things. So when someone does something that is similar to that, and it looks like that, like locking yourself in the bathroom or yelling at you, even though you were the one, you threw something at him, and then he starts to yell at you, it triggers those feelings. Your PTSD, your borderline trauma reactivity, doesn't necessarily have logic to it. It doesn't say, well, I did throw something at them. It doesn't have that ability. He's yelling at me, and then I feel like I'm trying to make things better, but on the outside, I'm actually yelling and insulting and throwing things. But I feel like I'm actually trying to express that I need you, please don't leave me. And then he does leave me. You can imagine that triggering someone, and then the distress just spikes in the same way that someone coming back from war, they hear a gunshot or something that sounds like a gunshot or a helicopter or something I hear from a lot of veterans who were in Afghanistan will tell me that when they're driving under an overpass on the freeway, because that's often where IEDs would be. And so they will go under an overpass in the States, and there's even though rationally, like, there's no chance or very little chance there's going to be an explosive device as I go under this overpass. My body does not know that. My body goes through a massive distress spike, and I'm completely beside myself. Now, with borderline, not only do you have that same feeling often, not all people with borderline have this, but many do. Some would consider if you didn't have that, you don't actually have borderline, but we don't go into that debate. So for the person with borderline, not only do they have that same exact distress spike, but they also don't have insight into it. Someone with PTSD who went to war, they don't always, but they often will have some rational insight. They'll be like, oh, I'm having a panic attack because I'm going under an overpass because it reminds me of going to war. There's not really anything to danger, but I can't go, they might actually not drive anymore as a result because they know how they react in those situations. But if you ask them, is it rational to worry about that? They'll say, no, it's completely irrational. So that's the difference. People with PTSD, because they were hopefully raised well enough such that the trauma actually is the exception to the rule. For people with borderline, the trauma is the rule. Abandonment is the rule. Harm from others will always happen. It's always happening. And so they're completely just a slave to their own emotions. Their emotions completely, they happen in very big ways, much bigger than other people. And they have, depending on their degree of borderline and their level of recovery, potentially no insight into why it's happening. So the person with borderline is much worse off than the person, generally speaking, than the person with just PTSD, because PTSD, you can still have some insight into it. Not that PTSD is a walk in the park. It's not. It's horrible. But the person with borderline has a lot of things that are standing in their way in terms of their ability to even know that they're doing something odd. You know, many people with borderline pre-recovery believe that everything they feel and think is completely rational.
Were there another group of checklists that Dr. Hughes used?
Yes, so she also, and I forgot one on the last because I don't think of it as one, but previously I'd explained, and I do not expect you to remember, it's called the Life Events Checklist, which is just an inventory of experiences a person may have gone through that are traumatic. Dr. Hughes also used that, and that's appropriate to use before the clinician-administered PTSD scale, the gold standard, CAPS-5. However, she administered this long ago before she gave the CAPS-5.
Right. So if Dr. Hughes was going to be more convincing to me and demonstrate that she wasn't trying to make up for the fact that she didn't have good data to back up her claim, then she would have said, well, I administered these checklists, but the jury should know that these checklists actually don't measure whether or not someone has these things. It's just a quick and dirty way to find out what the individual is reporting to me. I don't know if they're telling the truth or not, but I did determine that they were telling the truth later on because I did these other things. A lot of it had to do with hearing her stories, talking with her previous therapist, reading those medical records that indicated that she had been talking about being abused when, years and years before her and Johnny Depp started thinking about divorcing, which is, research shows that's an indication that they actually were being abused, because why would you be lying to your personal therapist all the way back then, long before litigation is even thought of to the individual? If she said something like that, then I'd be like, oh, okay. But when you consider that she was padding her results with these measures that mean nothing, really, they literally mean nothing to us forensically. I mean, I guess it means a tiny bit. It means that, because if someone was to be a really bad liar, they wouldn't even be able to pass those tests or indicate that they had PTSD on these checklists, because they're just so terrible. But we can't imagine that even being possible. But anyway, so the fact that she was seemingly, who knows, padding her testing to make it seem like her claims were more valid just throws everything into question. And that's why Dr. Curry is so believable, because when she was asked, was there intimate partner violence? Was one or the other person being abusive to the other person? She said, I can't answer that question because I don't know. I can only go off of people, because she could have said, well, I looked at all the records. I heard all of Johnny Depp's claims. I looked at all the other things, and I concluded that Johnny Depp was a victim of intimate partner violence. She could have easily said that, given what we've heard. Easily. I mean, that one audio clip alone would justify someone in this situation making a pretty strong claim about that, but she didn't say that. So that lends to her credibility, which is what I was trained to do. It's like, just, stick to the facts, then you will become much more sought after as a forensic psychologist, because you come across as much more believable. Don't mess with the data.
It was never intended to be used as a retrospective measure to look back in time and find out whether abuse was occurring based on one person's report.
Yeah, and of course, since it's self-report, right, if you're trying to feign something and lie, and you know that the results from this are going to be presented in court, then, yeah, it means nothing.
No control for exaggeration or minimizing. It was just given to research participants anonymously so that we could get data on the prevalence of abuse and how abusive dynamics work. And on that, there's 39 questions where the respondent indicates essentially certain abusive behaviors they may have engaged in, and then 39 where they indicate behaviors their partner might have engaged in. And obviously, you can understand that in a forensic setting, the respondent is likely to put a very minimal amount of behaviors they engaged in, and then extremely increase the number of behaviors their partner might have.
Now, you notice that Dr. Curry is not saying anything as to whether or not Amber Heard was abused or not. What she is saying is that there was strong evidence that she was feigning PTSD. But she will never say, and has never said, I'm guessing she's never going to say, anything along the lines of intimate partner violence. Dr. Shaw didn't say anything along those lines because he wasn't evaluating them, but Dr. Spiegel did, even though he didn't evaluate either of them. Dr. Hughes did make a claim about intimate partner violence. Now, does that mean that the Johnny Depp team is just better at finding more competent evaluators, or does it mean that there is enough strong evidence that Johnny Depp was physically abusive to her, and so they're avoiding the question altogether when it comes to the forensic testimony? I guess y'all can make your own choice on that, or some other option.
If you're in a civil litigation, the person's motivated to have the results be consistent with a claim or an allegation of intimate partner violence and an allegation that they've been severely harmed, then they could simply just check off more. And not only that, but checklists like this one specifically give a lot of nuanced information about what clinicians might be looking for when they're assessing whether violence was present or whether the person's self-report is consistent with a genuine.
I mean, that's a really interesting point that she's bringing it up. She's brought it up before, and there's no way to know, of course, if that is the case, but it is, I'm guessing, influencing to the jury. I don't know that. I have no idea what the jury is thinking, but I'm just imagining myself being a lay person, because I assume that there are no forensic psychologists or mental health people on the jury. From my own experience going to jury duty, as soon as they found out that I was working in mental health, I was immediately excluded. Like, there's a lot of reasons apparently why lawyers would loathe to have someone like me. But I wonder if that would be a really convincing point, that because Dr. Hughes did what she did, she actually gave Amber Heard ammunition such that she would be able to fake it even better moving forward. You know, I don't know. I don't know if that's true or not. I suspect that if I was to take a guess as to what really happened, is that Amber Heard has been abused throughout her life. She was abused by her parents, her dad at the very least, I think, and saw violence in the home, I believe. I'm trying to remember. But, you know, rough childhood, and has some trauma symptoms, some trauma reactivity. It doesn't have to be PTSD. It could be borderline. It could be other kinds of things. And then at the age of 22, meets Johnny Depp, and within a short amount of time, there's at least a lot of verbal abuse and a lot of harm being slung both ways. So her whole life, you could argue, and who knows what happened in between moving out of the house and meeting Johnny Depp, and it could have been more, who knows. Her whole life has been filled with trauma. The trauma of going through this trial, even if you would contend that this is all self-inflicted, which a lot of people from trauma will do. There's a lot of syndromes and defenses that will be developed that are helpful when you're 5 years old, but actually shoot you in the foot when you're an adult, that can result in actually causing even more problems in your life. We see this all the time, unfortunately. And then the trauma of all the people attacking her, which is not okay. It's one thing to have an opinion or to roll your eyes at someone or to talk with your friends. It's another thing to do things such that she hears it and knows about it, yelling at her on the street or DMing her, which I'm sure has been all turned off at this point, writing articles that are high profile, that are very hurtful and bullying. Now, might she deserve it? I guess there's a world where one could make an argument, but even if she is guilty of all the things that people are thinking, I still don't think that she deserves. I mean, people like this deserve to be pushed back on, of course. They deserve regular kinds of consequences. You know, just think about if Amber Heard were not famous, Johnny Depp, and, you know, they're not famous people. There would be a lot of consequences to this. And these sorts of things happen, by the way. Now, it wouldn't be a defamation case because it would have to involve some kind of, well, I guess it could be like if you told their workplace that, and they lost their job, okay, non-famous people could do that. Then, you know, there's a lot of consequences in that action. You lose the case, people think you're a liar in your circle, but for her, the consequences are 1,000 times the degree that they should be because of the high profile. And I just don't think that that's something that we should be doing. The other thing that I'll say while I'm on this topic is that there's a possibility that in 20 years that we will look back at not only this trial, but also the media frenzy around her and think, oh my God, they were so misogynistic in 2022. The way that they were I mean, we know that that's true right now anyway. I mean, the way that people are talking to Amber Heard, not everyone, but some people, it's particularly on the internet, are talking about her and to her are absolutely built on a foundation of hating women and misogyny. It's very clear to me. We've seen it time and time again. We've seen it through history, and we seem to never learn. And I think that it's happening. It's most definitely happening right now. I don't know to what degree we're going to conclude 10, 20 years from now, but we've done this over and over again. We did it with Monica Lewinsky. We did it with Anita Hill. We did it with Janet Jackson. We did it with Britney Spears, Pamela Anderson, Paris Hilton to some extent, Kelly Marie Tran from Star Wars. I mean, that was a particular group of people, not all of us, but all of us did it to Monica. I mean, all you got to do is watch the documentaries about Monica Lewinsky or about Britney Spears, Sinead O'Connor, Vanessa Williams. You could say Hillary Clinton to some extent, depending on how you see it, but a lot of people do see it that way. Like I said, Anita Hill. There's these very clear examples of how, as a society, as a group, we were misogynistic to these women who were actually suffering from oppression and from abuse and from problems that were not their fault, often at the hands of men. And yet they are not only seen as guilty themselves when they weren't guilty, but they're ridiculed just nonstop. All you got to do is look at the talk show hosts, Jay Leno, David Letterman, making jokes. I mean, Monica Lewinsky, she was a very young woman, her early 20s. Her boss is the president of the United States, and he is having sex with her and telling her to be quiet about it, and somehow through all of that, and if you're young, you don't know this necessarily, but at the time when all that story was coming out, I mean, certainly Bill Clinton was raked over the coals, but she was completely made fun of. Everyone, she was a joke, she's a slut, she's ugly, why would he be with, he could do better. I mean, just joke after joke after joke after joke. Anita Hill, just look into the history of that. And so it is atrocious, and it is absolutely happening right now with Amber Heard. So I hope y'all will not participate in that. Doesn't mean you have to think she's telling the truth. She could. So that's the other thing. People who have those memories and have been through those experiences of not only misogyny throughout their entire life, but also victim blaming and victim denial. People who have been through that, when they look at this case, if they're a woman, in all likelihood, they would see so many parallels to what's happening right now. Because there is a very strong possibility that she was severely abused, sexually, physically. We don't know because the evidence doesn't look that promising, but maybe she's just really bad at telling a story, or she is prone to exaggerating things, and then it throws everything into question, particularly in court, right? Like there's a world where he did hit her repeatedly, and she did have a bruise, but she used a filter on the picture, and then later when asked about it, she can't come clean about it because she can't tell the truth for some reason. She's afraid of telling the truth, or she's been told. There's just a lot of possibilities that all that is happening, and if you come from that place and that history, looking at this, it's like it's happening all over again. It's Monica Lewinsky happening all over again. It's Sinead O'Connor. It's Anita Hill. It's Britney Spears. It's Vanessa Williams. It's all these people who were just living their lives and possibly being victimized, depending on the story. Lindy Chamberlain, they're just living their lives, and somehow, because they're a woman, they are not believed and attacked ruthlessly. Not only just attacked, but also attacked about their femininity, attacked in a way that you would only attack women by particular people who seem to attack a lot of women, i.e. misogynistic people, a lot of men. So I want to be very clear about that. In fact, someone emailed me, when I get emails, I get a lot of emails and a lot of comments and stuff, and it's weird because the criticism or the constructive feedback is often hurtful, harsh, like not giving me any benefit of the doubt. Not to say that I don't appreciate, in fact, I love constructive criticism when it takes into account that I'm trying, or that I have a track record otherwise, I've been speaking out against misogyny and sexism and these kinds of things. Amanda Knox is another person. I did a whole episode about Amanda Knox years and years ago, and concluded from all the data that she was another person that it was her roommate that died. And not only the Italian authorities, a lot of the Italian people, but people around the world. Foxy Noxie, her roommate is murdered. And because she has a very weird post-crime response, when the police arrive and the cameras are on her, she presents as very weird. She's a very odd individual. That doesn't mean she's guilty. And there are people today, because I said this, that will email me and say that I'm an idiot because I think Amanda Knox is innocent. I don't know if she's innocent or guilty. I can't know. But there's a strong indication, given the fact that the authorities have decided that she's not guilty. So there are countless examples of this, and it's happening. Someone emailed me some constructive feedback around this, but because they're a long time listener to the podcast, she was giving me the benefit of the doubt. She's like, I know you know this, but I feel like you haven't really emphasized da-da-da-da. And so I was like, yeah, you're right. I haven't emphasized that, and I've noticed it. I mean, it's obvious, it's happening. In 20 years, whether or not the documentary in 20 years concludes whether or not Amber Heard is lying or not, they will also say, put that aside. Let's look at the way people were treating her. And let's compare that with the way people were treating someone like Woody Allen. Woody Allen is in a similar category to me, where it seems pretty clear that he did something horrific. And you could easily argue that what Woody Allen did was much worse, because at least Johnny Depp is a grown man with a lot of resources and money. He could have left. Now, of course, they can have battered partner syndrome and be gaslit into the situation, but he didn't seem to operate that way. I don't see a lot of signs. It could have been true. Either one of them could have been that, but Johnny Depp didn't seem to operate like that. I think they were very much in love and enmeshed, and triggered each other's issues such that it drew them even closer together. And then they developed this very destructive cultural pattern between the two of them of screaming and her throwing things. And I'm going to take a guess and say that if he were to tell his story, he would say, I should have left a long time ago. But I just kind of thought, I'm just trying to get it to work out. But I didn't feel unsafe. I didn't feel like I couldn't leave. I don't know that, though. He could have felt like he couldn't leave. Many men in partner violence relationships feel that way. The same way that we will characterize women victims of this, where they feel completely trapped. They have no way to get out of the relationship in a viable way. He absolutely could have. Anyway, point is that that's another element to all this, is misogyny, and it's happening. In 20 years, are you going to be someone that participated in it, laughed at the jokes, will be ashamed of yourself, or will deny it 20 years from now when we watch the documentary? Are you going to be like, I didn't do that? Because, the Monica Lewinsky jokes, I don't remember anyone not laughing at those jokes. I remember everyone laughing, ah ha ha ha, or Vanessa Williams, or whatever. I remember all the jokes. Because they were, when you see all you got to do is, go on YouTube, look at the David Letterman, Jay Leno, all the comedians, stand-up comics. The audience is filled with all sorts of people. Everyone's laughing. Anyway, the point is that who are you going to be? And who am I going to be? And I have to ask myself that question as well. How is my indoctrination into a sexist society showing itself as I watch this? It undoubtedly is. But am I fighting against it or not? Am I fighting hard enough against it or am I not? And what are you doing? Are you doing things to make sure it doesn't happen? And by the way, being a woman doesn't make you immune to it, because the Monica Lewinsky jokes were told by women, laughed at by women, because sexism indoctrinates everyone, regardless of gender. So we all just have to look at ourselves as we go through this, because that's part of the change. We don't want a sexist society. We don't want to live in a misogynistic society, and it begins with us. All right, well, that does it for that episode. Everyone out there, please take care of yourself, because you deserve it. You really, really do.